how best to demonstrate these to my viewers? Shadow! Hello everyone, and welcome to another video on our own devices. I'm Jean Messier, and today we are having a look at a set of fascinating, if rather cringe-inducing, vintage medical instruments. Now, when I first picked up this set, I thought that it was for performing laparoscopic surgery in which the instruments are inserted into very small incisions in the body. However, after a bit of research, I discovered that these are in fact what are known as cystoscopes, designed to be inserted up the urethra in order to examine and carry out various diagnostic or surgical procedures in the bladder. So yeah, if you happen to be a bit squeamish, buckle up. This particular set of cystoscopes was manufactured and sold by the Electro Surgical Instrument, or ESI Company, aka the Rochester Surgical Appliance Company of Rochester, New York. And while I've not been able to pin down the exact manufacturing date, the earliest catalog reference I have found dates to 1909, while some of these instruments bear patent dates going back to 1899. Most of these appear to be based on the designs of one Dr. Bransford Lewis, specifically the Bransford Lewis Universal Cystoscope, patented in 1906. Lewis was a professor of genitourinary surgery at St. Louis University and St. John's Hospital, who in 1915, along with Dr. Ernest G. Mark, authored one of the classic textbooks on cystoscopy and urethroscopy. Now, if you want to learn more about the fascinating historical development of cystoscopy, I have included in the description below a link to a PDF copy of that very textbook, which does include a brief historical section. But in brief, the term cystoscopy or cystoscope comes from the Greek kystis and skopien, meaning bladder and to observe. And indeed, this is also the root of the modern cyst, meaning an abnormal fluid-filled pocket of tissue. Now, while crude specula for observing the female urethra date back all the way to ancient Greece, and some attempts were made at creating a modern cystoscope in the early 19th century, all of these early attempts were stymied by the difficulty of getting adequate amounts of light through the urethra to observe the inside of the bladder. Early instruments used various systems of mirrors and lenses to direct candle or lamp light through the instrument, but this problem was not adequately solved until the 1870s when various physicians and inventors, including William Wollaston, Julius Brooke, and Max Nitze, developed instruments illuminated by an electrically heated incandescent platinum loop cooled by circulating cold water. Then in the 1880s, Charles Preston, David Newman, and others incorporated the newly perfected Edison incandescent light bulb into their designs. The classic compound cystoscope design, which was later improved upon by Lewis, Brown, Fenwick, Brenner, and others, which is well represented by these instruments, was introduced in 1889 by French physician Boisseau-Vacher. Now, like any specialized branch of medicine, cystoscopy has a very long history and plenty of nuances that are far beyond the scope of this video, so let's actually have a closer look at these particular instruments and let me show you exactly what these were meant to be used for. So the first thing you will probably notice about these is that they are huge, the outside diameter of the barrel or sheath ranging from 7.66 to 8.33 millimeters. As per the numbers stamped on the ends of the instruments, this corresponds to numbers 23 to 25 in French gauge, a system for measuring catheters developed by 19th century French instrument maker Joseph-Frédéric Benoit Charriat. Unlike other gauge systems for measuring things like hypodermic needles and shotgun barrels, in French gauge the higher the number, the greater the diameter, with 1 millimeter equaling 3 French gauge. If you want to learn more about the intricacies of these other gauge systems, please check out the video I wrote on the subject over on Today I Found Out, link in the description. Now, this diameter range indicates that these particular instruments are intended for use on male patients. Female cystoscopes tend to be a little bit larger at between 29 and 30 gauge. Male cystoscopes also tend to be a lot longer due to the extra length of urethra contained in the penis. As you can imagine, having something like this shoved up your urethra would be a tad uncomfortable, but thankfully the standard procedure at the time was to numb the urethra using tablets of allopurin or cocaine analgesic inserted through the cystoscope. Today, in the rare instances where rigid cystoscopes are still used, the procedure is usually performed under general anesthesia or procedural sedation. More often, though, thinner, more flexible cystoscopes using fiber optics are used, with the discomfort being managed using topical xylocaine gel, and thank goodness for that. Now, while each of these instruments is designed to perform a particular set of procedures, they all share some common design elements. These are all so-called composite cystoscopes, comprising a separate hollow barrel or sheath into which various accessories can be inserted. This is in contrast to older-style fixed-lens cystoscopes, in which the lenses for observing the interior of the bladder were permanently integrated into the barrel. Most of these instruments also feature one or more spigots and electrical bayonet connectors at the operator's end. The spigots are for attaching either a syringe or a rubber squeeze bulb for irrigating or keeping the bladder distended with water or air. This not only opened up the bladder and made it a lot easier to observe and operate on, but also allowed the doctor to flush away any blood, pus, cloudy urine, or other fluids that might further obscure his view. Now, according to Bransford Lewis's textbook, it was most comfortable for the patient if the bladder was inflated with warm air. So doctors of the period would place the inlet valve of their squeeze bulb close to the flame of a candle or alcohol lamp. The bayonet connectors, meanwhile, are for connecting the power source for the illumination lamps. In some models, the lamp is permanently mounted at the end of the instrument, as you can see here, the bulb being accessed by unthreading this tap. This particular arrangement, where the lamp sits backwards in the beak of the instrument, shining into the window or fenestra cut in the side, was an innovation of Bransford Lewis. Most earlier cystoscopes had the bulb mounted at the tip, casting most of its light uselessly away from the observation lens. By contrast, in this instrument, the lamp is mounted to a separate probe or light carrier which can be slid down the barrel. In both cases, the bulb is connected on one side to this inner core of the bayonet connector via an insulated wire, the circuit return being through the instrument itself and the outside of the terminal. These lamps were designed to be powered by a variety of proprietary battery packs, which were housed in very professional-looking leather-covered oak cases, featuring post terminals and a rheostat for varying the light intensity. These varied mainly in voltage, between 3 to 5 volts DC, and longevity, typically 30 to 40 hours. Most were also configured for electrocautery, that is, the use of an electrically heated filament to sear tissue and staunch bleeding. However, the ESI company also offers something called the GEM current reducer, which was a step-down transformer that screwed into an ordinary light bulb socket. Now, this might seem rather strange to us today, but in the early days of electrification, the first electrical systems typically installed in homes and businesses were lighting setups. And so the first generation of electrical appliances, such as toasters and clothes irons, were designed to plug into the only available electrical receptacle, which were light bulb sockets. Now, as previously mentioned, a wide variety of accessories were available that could be inserted through the barrel or sheath of the cystoscope once it was inserted into the urethra, and some of these included the aforementioned light carriers, obturators like these, which plug the windows in the barrel and make the instrument more streamlined and easier to insert, ocular assemblies like these for observing the interior of the bladder. These came in two varieties: direct view, in which the operator looked directly along the axis of the instrument, and indirect view like these, which are basically little periscopes that provide a perpendicular view out the side of the instrument. Forceps and scissors for grabbing, crushing, and removing bladder and kidney stones or making incisions in the bladder wall. Disposable wood and cotton or reusable metal applicators for collecting tissue swabs or applying medication. Syringes for injecting medication or contrast medium for taking radiograms of the bladder or ureters. Applicators for inserting analgesic cocaine or alipin tablets. Dilators for treating strictures of the ureters. Wire snares and cautery loops for removing polyps and tumors or staunching hemorrhages, and solid catheters for draining the bladder, for example when the urethra is obstructed by inflammation or growths. Finally, this particular cystoscope, which appears to be a Braun-Berger model, patented in 1909 by Leo Berger and F. Tilden Brown, is specifically designed for ureteral catheterization, that is, the insertion of drainage tubes or catheters into the ureters which convey urine from the kidneys to the bladder. Now, there are a number of reasons for performing this procedure, for example, to dilate and drain a blocked ureter, to measure the relative urine output of both kidneys, or to determine which of the kidneys is the source of blood, pus, or other discharge. Now, today, such catheters are typically made out of plastic, but at the time these instruments were introduced, they were typically made out of lacquered silk. To use this instrument, you inserted the catheters through these inlets at the rear and pushed them so that they lay along these two grooves. Now, a recommended practice at the time was to use so-called zebra catheters, which were marked with black and yellow or orange stripes 1 centimeter long, so that the doctor could gauge how far he had inserted the catheters into the patient. And if for one reason or another the entrance to the ureters wasn't easily found, then the patient could be given a variety of medications, including methylene blue and indigo carmine, which would stain their urine blue and cause it to stand out against the clear irrigation medium. Once the loaded instrument was inserted into the cystoscope barrel, the doctor would then maneuver the tip close to a ureter opening, then twist these knobs at the back to extend and retract this deflection plate, feeding the catheters into the opening. This particular instrument has 2 catheter channels, allowing both ureters to be catheterized without having to remove and reload the cystoscope, but others, like this model, have only 1. Once the catheters are inserted, the whole instrument was carefully withdrawn, leaving the catheters in place. Now, this set also came with these components, which appear to be part of some kind of storage rack or guide frame, and I haven't found any reference to this in any catalogs and have no idea how it goes together or how it is meant to be used. But if any of you know anything more, as always, send me an email or let me know in the comments. Finally, one last accessory worth mentioning is a training device called a box phantom, which was a small box with a hole representing the urethra and a 45-degree mirror reflecting a 4-quadrant diagram with a different shape in each quadrant. The idea was the student would insert a cystoscope into the hole and practice maneuvering it around and identifying the various quadrants of the bladder. And that, dear viewers, is a brief overview of turn-of-the-century cystoscopy, a medical field I knew nothing about until I came across this case of instruments. And that's one of the things I absolutely love about running this channel. I get to discover all sorts of obscure and fascinating fields of human innovation. Now, thank you so much for watching. I hope you enjoyed that. I will see you next time, another video where we'll look at yet more medical instruments and other fascinating devices just like these. Until then, I'm Misc from Our Own Devices. Have a great day.